name is Jessica Wisner. I am the head of client education and product evangelism here at Symplast, the very first all-in-one mobile first platform for plastic surgeons. So today I am so excited to invite to the podcast two frequent contributors, Dr. Shashi Kusuma, who is one of our founders of Symplast actually. And I'm so excited to also invite to the podcast today one of our frequent contributors, Dr. Joseph Russo, who is the founder of a very large nurse network, the Aesthetic Mentor in Massachusetts. So today we're going to hit on one of my favorite topics to discuss with these two, which is compliance. But before we get started, I want to have you both kind of talk a little bit more about yourselves and, what compliance means to you and also how you came to Symplast.
My name is Shashi Kusuma. I'm the founder of Symplast. I'm still an actively practicing plastic surgeon. And I keep a close tie on what's happening in the industry, not just in technology, but how technology interfaces with plastic surgery. And I also have a very keen interest in observing consumer behavior, physician behavior, and furthermore, how AI is going to impact all of our lives in the very near future. And I frequently engage with Dr. Russo via text messages, Saturday morning phone calls about patient care and a lot of these topics. So I'm very happy to be part of this conversation.
A board certified plastic surgeon as well. And I've been practicing for really almost 35 years now. So it's a long, long time. And when I started, it was a very different environment. Aesthetics in general was in its very rudimentary forms. And most people in plastic surgery look down upon guys who did aesthetic work as like not real surgeons. And obviously things have shifted a lot over time. But nurses really weren't a big part at all of aesthetic surgery. They were just really helping us. They never really did anything on their own. And then about, 15 or so years ago, they got started and they struggled. And I recognized an opportunity to actually train nurses. Because I guess two of my nurses actually were interested in getting trained in Botox. And they came to me and said, hey, there's this course in Florida we'd like to take. Are you okay with us doing that? I'm like, yeah, that sounds fine. So they flew down to Florida and my office manager flew down with them to be their model, and they came back after the weekend and each of the students injected my office manager like once, half, on each side of the face. And they weren't really even observing. There was one nurse from Texas who was overseeing it. So one nurse was training 15 other nurses in a hotel room. And each person was injecting one person and like not being observed. So they came back on Monday and they really had no idea what they were doing. They had this beautiful shiny booklet that was all laminated and it looked great, but they didn't even know how to really even reconstitute the product. So I ended up having to train them myself. And after this happened a couple of times, my wife said, what is wrong with you? Like, what are you doing? Why are you making these poor women travel all this distance and spend all this money and take time away from their families? And then they come back and you're training them anyway. Why don't we just create our own school? Like, you know how to do this. You know how to train people. You love to teach. Why don't we do it ourselves? So after about a year or so, we did. We opened a school. It was an aesthetic company in Massachusetts, and we became Aesthetic Mentor because we had a broader vision. And we started out with just a few nurses, and within a very short period of time, word of mouth just, drove us to in a different direction. We had more students than we could even transfer. We opened like 5 or 6 different schools in a short time because we kept, needing a bigger space because we kept getting overwhelmed with people. And that's kind of how it started for us 15 years ago. And then a lot of the people that I trained set up schools to compete with me. And, everybody started trying to do this and everybody had a school after a while. We're still standing and most of the other ones aren't anymore. But that's how it kind of started for us. And our real struggle early on was compliance. The real issue for us was like, how do we get orders to RNs? Because still today, an RN cannot provide a medical treatment without an order from a duly authorized prescriber, which in Massachusetts is an NP or an MD. And there was all this stuff going on. So I think Allergan actually put Shashi and I together. And Shashi said, I've been looking for someone with med spas. I said, I've been looking for someone with an EHR that can give me real-time orders. And that's kind of how it started. And so that he developed something for me that allowed me to provide this compliant umbrella for all these nurses to practice in. And that's really what grew us. That's really what started us and made us different from everybody else. And I still owe him a debt of gratitude to this day.
Yeah, and it's so interesting, working with your practice now that, I'm on the side with Symplast I've helped service your account over the years and seeing how you've continued to grow and how your nurses really stick with you long term. And I think that foundation that you set up for them is really a testament to that. And then, of course, that compliance piece, which is why we're here today, right? I mean, this is a topic, it is throughout the aesthetic industry. It continues to get legs and continue to consume the conversation because there is a lot of issues with people not being compliant or maybe not even realizing they're not being compliant. And we see it at every single trade show that I know you and I all go to. And I think even the med spa show last year, that was the keynote speech, was talking about compliance. So I think, continuing this conversation is critical, especially now that, we're in the age of AI and technology keeps advancing so fast. So I want to kind of open up the floor to you guys talking about, how the mobile first experience supports that, how you guys use it, how you think about it, and things that other physicians like the both of you should be thinking about their practices and leveraging technology to remain compliant.
I acquainted with a lot of surgeons around the country, through my work at Symplast, etc. And one of the surgeons that I met recently called me about a month ago, and he mentioned that he wanted to find if Symplast could offer a way to do good faith examinations for his estheticians, because that's apparently a law, a thing in Illinois. When he asked me that, first of all, I thought of you, Dr. Russo. I always think of you in the med spa space. I said, I wonder what Dr. Russo thinks about it. And I advised him that, we do have a telemedicine feature, telehealth feature in Symplast you could potentially use. We do have remote documenting that you could do live, even through, telehealth kind of a system that can document something like that. Our philosophy at Simplus has always been, how can we be the hub and the spokes really to kind of bring all of this into one umbrella, one ecosystem, because I really don't want to use 15 different systems to get just a little workflow done, right? What are your thoughts about that? Do you think estheticians should have good faith exams? If so, how do you think it should be done?
We ran across this very same issue in Connecticut, where I'm also licensed and I have a school there. And we didn't realize that these good faith exams were required at the time. And so we went through the same process of like, should we hire, an NP to like travel to these different offices and, do the good faith exam, which once it's done, it's good for, maybe a year or two, maybe it's good forever. Depends on the state. And ultimately we said, well, listen, if telemedicine really is acceptable, and again, each state has a different, like, well, it was acceptable during COVID, but it expired after a certain period of time and hasn't been renewed, all these things. But like in my mind, telemedicine is really the answer, with Symplast, because, when we're doing good faith exams for someone for neurotoxin or fillers, there are very few things that disqualify you from getting either of those products. And most of these patients are young, healthy, active, honest, upfront with their issues. And, there are very few things which disqualify you from treatment. So I think a good faith exam by an NP, or in Connecticut, it could be an NP, a PA, or an MD, is perfectly legitimate and reasonable and makes the most sense. Because if you could do telemedicine for someone who's really sick and in a hospital, or, has COVID or whatever they have, it should be more than enough for someone who wants to get Botox in their forehead. So that's what we've been pushing. And I think, in many of these states now, 34 or 35 of them, NPs have independent practice authority. So they're basically the same as MDs. So they can do all of these things. I still think they should be connected with an MD, at least for a couple of years, to get adequate training and get signed off and say, yeah, they've done the work, they're good enough to go, and they do their independent practice thing. I think telemedicine works. Symplast works for these good faith exams. NPs, MDs, can do them as well.
Yeah. And I think, you both mentioned different laws in different states, right? And I think that's where it gets really tricky is, especially if you're crossing state lines, because those compliance standards can vary widely. Where I know Dr. Russo, it's very strict in the New England area, whereas, other states like Florida and Texas perhaps are a bit more lax, or I believe Wisconsin is fairly lax as well. So, as we're continuing this, when we say compliance in 2026, knowing that landscape, like what should the number one thing that a plastic surgeon should think about when they think about compliance?
One thing I want to say, as less educated and less well-trained providers go out there, and you see an increased incidence of adverse events and bad outcomes for patients, and it gets reported to the Board of Registration of Nursing Medicine, DPH, cosmetology. These boards are driven by people making complaints, and once someone makes a complaint against you, they're they have to, by law, follow up on that and figure out if you're safe or not as a provider. So these complaint-driven boards are, looking for problems, looking to take bad providers out of the industry, et cetera. And as a number of these adverse events increase, legislators get involved and they're like, oh, well, we have to make laws to stop these people from practicing medicine or providing aesthetic treatments, et cetera. And it just starts to snowball. So as long as, we're putting bad providers out there, as long as we're providing inadequate training and education, it's going to keep happening. And right now, there's a tremendous imbalance between the number of people who are looking for treatments and the number of good providers able to provide those treatments. I mean, the ratio is just increasing every day in a bad way. So these boards, and this has just happened recently. I was telling Shashi, I was testifying to a subcommittee in healthcare in the State House 2 days ago about a bill to limit, to sort of control med spas, but in a really bad way. I urge them not to approve this measure. But the point is that when you talk about being compliant, it really means like adhering to all the laws and rules and regulations. But really, what it means is that you're providing, like particularly for nurses who need regulations and real orders. If they don't have an order before they provide a procedure, they're practicing medicine without a license, and it's like, it's malpractice, like from the first step you make, it's like per se. So you know, ability to defend yourself. It's malpractice per se, and it goes right to like, what are you going to pay that person? So what's the compensation? So the idea is that by having a resource like Symplast, you're able to sort of circumvent all these problems and deal right with the major issues: compliance, real-time orders, oversight. Like when a nurse at our network looks to provide a treatment to a patient, they upload all their data into Symplast, and their NP sitting there at this dashboard looking at that order. And they look at that order, they say, is that order realistic? Is it the right toxin? Is it the right product? Is it the right dose? Is it the right region? Is it the right, everything, right route? And if it isn't, they won't put an order through. So they stop it. There's a moment for oversight. They can correct the order. And so it's like multiple sort of points where they're checked. And once they get the order right, they can then administer that treatment. And if they do something and they have a problem, some sort of adverse event, we mandate that they get more training. You can't treat any more patients, and you come in and get some remedial training. A lot of oversight, and it's really arduous. And we audit their charts. We say, we need to see your charts. Oh, this guy's missing a consent form. Like you can't do that. We fine them. They have to pay more money next month for their membership fee because they're now on probation. So it really is a full-time, rigorous job, and we need a lot of staff to do it. But I think in the end, we have a very small number of adverse events relative to the number of procedures that we do. And that's ultimately what our goal is.
Yeah. Dr. Kusuma, from your standpoint on, thinking technologies, and that's really your passion, right? What do you think about and think plastic surgeons should think about in 2026 when it comes to compliance and technology?
Know that the power of technology today is so immense and logarithmically improving that we all have to be very careful in how we market this to the world and how we educate and how we call people out to the world. If the assumption is that the interest in these type of services is going to increase, then logically it follows that many entrepreneurs of all types would want to be in this field because it's a growing market. And that would mean that non-core businessmen, non-core physicians, non-core practitioners would want to be part of this. So it builds almost like this beast of an ecosystem of its own, because if you have more interest in services, then you want to provide those services. Well, how do you do that? You do that because in a way to increase the number of people that can provide those services, which means that they all need education. So now you get a cottage industry of educators and meetings galore all over the place that's try to certify you. In Florida, Sun Sentinel put out an article, which is where I practice, that a lot of Florida is unregulated in this completely, and it's been big news. And I shared it with you, Joe.
Yeah.
And so it's the truth. While we as surgeons trained in the Hippocratic Oath and all the rest of it, want to make sure that it's safety first and all that, patients may not feel that way, even today, because they may go to the cheapest place because it saves them money. And AI could have a very, very big role potentially here, because it could very quickly figure out, a lot of the parameters that it's been trained on to pick up on cues, and that can provide real-time information for people to make better decisions. Technology could flag things very quickly and have things be shared with the regulatory compliance, mechanisms very quickly. You could capture these moments very easily with technology, where people can't hide and have evidence of malfeasance or whatever else it might be, or bad practices or malpractice type of situations. You could create a secondary network of sorts, which is similar to what Dr. Russo created in Massachusetts, which is how can a technology like Symplast offer this for a surgeon's network across the country, or physicians networks across the country, that could be easily create, an environment that could be providing oversight for these sorts of things and review it in real time, because the speed of which with AI can do this could be quite rapid. And also, I think this whole business now about morphing a face and showing what they would look like also can be a problem, because you're now setting up expectations despite the disclaimers that this is what you're going to look like. But we know that's not the way things work out many times. We know that's not the way healing happens many times. We know there's a process from a good before picture to a good after picture, and there's a lot of time between that goes up and down sometimes. And that gets eliminated because of the quick visuals. And I think the only way to manage this is going to be to put technology at the center of it, make it the hub of oversight, in a real time basis, not retroactively, not proactively, but in a very real time basis.
You brought up some interesting points, Dr. Kusuma, about using AI and technology to morph faces and create, what we think might be a realistic before and after, but the reality is that it may set in a expectation that's not realistic. So I'd love to just talk about that a little bit more, because I think that is, if we're talking compliance, does that create an additional risk for the practice?
I resisted using it myself. And as a matter of fact, when I do some educational videos, which a lot of people find very helpful, so I do them for people. And now I say, I'm the real Dr. Kusuma. I'm not an AI avatar. I'm actually taking my pen marker and actually drawing everything on the board myself, so that it feels human. It feels real. It feels authentic. It feels, I don't have to have everything so polished. I don't need this much efficiency in my life. Sometimes I feel like I want some normalcy, normal human stuff. And so I take it with a big pinch of salt, because I think it's useful when I want to drive home an educational point. But I'm very careful not to show what they would look like, although everybody wants to see that, because it makes them feel good that this is potentially what I could look like. And, there's cases where I use it for that purpose, but for the most part, even today, I use it for mostly education purposes, not promises of this is what you're going to look like, perhaps. For that, I usually use before and after of other people that have already actually gone through it, and as an example of what they could see as an example, because it's a real thing versus a fictional creation.
Yeah. Dr. Russo, I'd love to get your thoughts on this, because for me, immediately I start thinking about the nurses you work with and the way that this type of technology is very appealing to a single provider practice, which is what many of them are.
I see some danger in it. Personally, I do a lot of education and teaching, and one of the most difficult things that I have to teach is called facial assessment. So, looking at a face and saying, like, which eyebrow is higher, which frontalis muscle is pulling stronger, which cheek has more volume, which cheekbone is higher, what's the normal ratio of upper lip to lower lip ratio, in a Caucasian female. All these things that you look at. What's the normal angle of a man, of the mandible of a woman versus a man? What's this angle? And so, when you start looking at that and really using your eyes to look at patients' faces, you realize that when you look at someone at a first glance, your brain tells you that everything is symmetric. Like the eyebrows are the same height, the cheeks are the same, there's an equal volume, but when you really look at it, we know that's not true ever because the two halves of the face develop separately when you're in your mom's tummy. They fuse in the midline. And if they don't fuse completely, you have a cleft lip or a cleft palate. So we know they're two separate halves. We know your hands are different sizes, your breasts are different sizes, your feet are different sizes, your legs are different lengths. Everyone's that way. It's just a matter of degree, right? And the real point is, can you as a provider see it? Because if you can't see the problem, how can you fix it? You might be making it go worse. You might be adding more volume to the cheek that already has too much volume, you know? So that's a really important skill to attain. And it's one of the hardest skills to teach. And it involves like you're getting to the point where your eye can overrule your brain. Because if you keep looking at something and keep studying it, it ends up just becoming like everything's the same. So we have these different techniques where we look away and look back, look away and look back. And the first thing you see is the right thing because you see it before your brain shuts it down. And so it's a technique that I've used a lot and it's very effective. Now, when you're looking at AI versus, a normal human, how can you tell something's AI? And you can tell something's AI because it's symmetric and humans aren't. Humans are not. So if someone looks too perfect, they are too perfect. It means they're AI. You know what I mean? So that's kind of how, but also Shashi and I have talked about the fact that it sets up unrealistic expectations on the part of the patient because they think everyone's supposed to look that way. And that's an impossibility. I mean, it's an impossibility for anyone to create symmetry, and you don't want to create symmetry in a face because symmetry does not look normal. Symmetry looks AI. You understand what I'm saying? So you have to accept asymmetries. You can minimize the asymmetries, but they're always going to be there. And if you look at any top model in any magazine or any beautiful woman that you see every day, if you start measuring things, analyzing it, they're all asymmetric. But it's still beautiful because beauty isn't microscopic. Beauty is macroscopic. Beauty is the whole, taken as one. So when you see someone who's really beautiful, your eyes don't stop because your eyes keep looking at that person, looking at every part of their face and their hair and their neck and their lips, and because it just all flows and it's beautiful. If you look at someone and your eyes just like stop because their lips are too big or their lashes are too big or their nose, something stops your eye, like driving down the highway and seeing a car crash, you can't not look because you're thinking, oh my God, is someone injured? Do I have to get out of the car? Or is there going to be an explosion? Whatever it is. The same thing happens on the face. As you're scanning the face, if you see your eyes stopping at a certain thing, your eyes telling you there's something wrong with this picture. You've gone past the point of what's normal. So when we're trying to create beauty in a patient and you look at someone and say, oh, you've had some nice filler in your cheeks. If you know someone's had filler, to me, that's too much. If you know someone's lips, if you're looking from 20 feet away and you can see their lips are too big, that's abnormal. Your eyes alerting you that that's abnormal based upon the history of all the lips they've seen in the world in whatever number of years you've been alive. And suddenly your eye stops you, that's not right. So now, as Dr. Kusuma was talking about, you're putting AI into it, and AI is trying to create these people that are perfect. And so there's a real sort of pushback because number one, patients are expecting to look like that. Number two, we can't ever make them look like that. So where's the rub in the middle? Like, how do we solve that problem? Because humans are imperfect. Humans look imperfect, but they can still be very, very attractive with those with those imperfections. And if you ever look at those cameras that can take one half of your face and duplicate it, like if you look at Harrison Ford, for example, his one side of his face is so like down and like this, and the other half is kind of up. And when you duplicate each of those halves, it looks like two completely unrelated different people. But when you put them together, it looks like a pretty handsome, decent guy, kind of a rugged guy, very famous. But separate, he looks crazy. So these are some of the problems we're starting to encounter. Dr. Kusuma has expressed to me some frustration with the fact that some of the results that we feel as plastic surgeons are pretty good results in our own hands are looked at patients as like, well, this isn't perfect. I'm not happy with this. Like, I'm unhappy. And so the level of expectation is getting to the point where it's not possible. Are we being set up for failure? And is this impossible? That's some of the discussions we've been having.
You have to really know what makes somebody do something. Like, for example, if I am very passionate about technology, I've been this way for 20, 30 years. I just didn't wake up one day and said, I want to have a career in technology. Like, to become a plastic surgeon, Dr. Russo has been working on this. He's been in practice for 35 years, but he had 10, 15 years of training prior to that. So it's been really 50 years. You just don't wake up and say, I'm going to start doing injections on people.
Yes, right.
And so in this very competitive space where the business is growing, a nurse can wake up one day, or a nurse practitioner will wake up one day, a doctor can wake up someday. I'm tired of going to the hospital. I'm tired of being on call. I'm just going to go get a job to be an injector. I mean, I just want somebody to pause and think about that. I mean, so essentially for you, it's just a convenient lifestyle. That is what you're looking for, not because you spent 30 years thinking about the problem, not because you studied beauty, not because that's been the passion, that not because you've seen all the good and bad and kind of seen the gamut of things and all those sorts of things. And suddenly you wake up and you want to do that. And that to me is a place where all these new technologies could be very attractive, because they're trying to take shortcuts and say, well, I have this tool, I could do AI morphing, and I can give you this, and that's going to create a sale for me so I can increase my sales. And all these business consultants are going to tell you that's what you should do, because then your per customer ticket's going to be this much, and this many foot traffic you're going to have, the room usage is going to be this much, and therefore this is how your financials are going to look, and that's what they're going to look at. But the important human element of all of the intangible things that go into having that relationship and having that background is lost. And then this is when trends become popular. AI could be amazingly great at creating great educational tools, at communication, at workflow efficiency improvements, at giving people peace of mind and freedom of time or freedom from time, flexibility in traveling, and a lot of other things. It'd be amazingly useful to have AI. So even that requires people to take a moment and think about the bigger, again, to use the word macro picture, or systemic effects or downstream effects of everything that we do, which is where I like to be a lot, because I like to think about the entire 360-degree of systemic effects that are fifth order downstream from a decision that I would make today. And how is that going to impact all of these things? And that's the level with which I think about anything like that. And as a plastic surgeon, similarly, if you're injecting anything, we're thinking about, what if this happens wrong? What can I do? Can I fix it? What if that goes wrong? What is my backup? And so these are the things that I think get lost in this technology-driven world, because everything's about speed and efficiency and getting it done immediately and immediate gratification sort of things. And medicine is generally should not be like that, because it's such a human discipline. So I do see a lot of issues, because I do think it's going to be abused.
Yeah, I think that kind of takes me to one of the points I wanted to talk on, was about how convenience kind of puts us in that tricky place of where compliance becomes kind of a gray area, because we're going for the convenience. And it's not, because we're trying to serve some purpose. And so we're using the technology to do that. But it can put us in a tricky place as far as compliance goes, because maybe we're educating. How do you look at those technology tools that you choose and make sure that they are going to keep you compliant as you are using them to grow your business and use it for marketing and other things?
One of the biggest problems with compliance is, oftentimes it's expensive. And as I was talking to you earlier, I was testifying before the Senate, this subcommittee on healthcare, about what the regulations they wanted to use to restrict, healthcare and the med spa space. It just, it was going to become so incredibly expensive that it was going to basically force a lot of providers out of business and force people who are not being, compliant to actually rise to a different level, because they can provide it in a cheaper way. So really, a lot of it's about the money too. So compliance is expensive, but not being compliant potentially is even way more expensive, because you could lose your license, you could create bad outcomes, etc. So, compliance is important, but it has to be done in the right way. It's wonderful. It's expensive. And sometimes that forces people to become less compliant because they can't afford to be compliant. And they end up like being on a black market essentially, and providing subpar services, getting bad outcomes, bringing the whole industry down, trying to create more legislation. It's just a vicious cycle. So maybe AI, maybe Shashi comes up with technologies that are accessible and affordable, and allows us all to be better providers because the information is now being shared about how to inject and where to inject and how maybe the AI says, you put point 0.2 there, point 0.5 there, point 0.1 there, helps us understand in a better way where we can treat patients and how we can treat patients or whatever it ends up being. It's a potentially very valuable tool, and Shashi can speak to this better than I can, but it has to be accessible to the masses. It has to be affordable, and it has to make sense and be usable in a way that any individual can adopt it and be successful.
Yeah, technology here could be hugely beneficial because it can drive the price of compliance way down because you can essentially remove the human element in there. You can remove the legal element in there, or at least make it simpler, I should say. And you can have the oversight be real time, like we talked about, without having a lot of backlogs and delays and all those sorts of things. The more conveniences you get through technology, the worse human you're going to become, despite the marketing mumbo jumbo that it's going to be so much better for you because you'll have all of these things. But actually, it could be the exact opposite effect. And so similarly, if AI is giving you too many cues, too much information, then you will not grow in your own assessment. You'll not grow in your own screening. You'll not grow in your own skepticism. You'll not grow in your intuition and instinct, and you will actually become worse, much, much worse. And so this is where, a thoughtful balance of how far to go to use it and where to hold back and how to create a product that's going to be able to respect the balance between the two should be useful. Just because you can build it doesn't mean you should. Just because you can use it doesn't mean you should. And so I think as somebody deeply and steeply in tune with technology and product and use cases and all these sorts of things, these are the kind of things I worry about and I think about. So in this topic, compliance would be a huge benefit, I think, without a question, and a huge cost saving.
Yeah. I think, Dr. Kusuma, you touched on a point that is my favorite topic to talk about when it comes to technology is never lose the human part. You use the technology to allow you to provide better human care. What are some other tools or easy wins that you think providers could take away from this conversation to allow them to stay compliant and still provide that better human care by using the technology to do that?
I have a simple answer: just use Symplast.
I mean, that's the obvious one, right?
What I've always thought about and for more than 10 years is, and now AI may be able to solve this problem, is to create an assessment tool because when most of the injectors start out, Shashi, they'll just inject you with one syringe in your nasolabial fold or someplace. They don't know how to do a full face assessment. They don't understand how to talk to patients about where they're lacking. They're more driven by what the patient sees, and the patient just sees the symptom, not the disease, so to speak. They don't see a full face descent. They see these lines and they want to treat the lines. And the inexperienced injector will do that. The inexperienced injector will inject one syringe, maybe two. They're not understanding how to see the patient as a whole. So I think I've always wondered if there was a tool we can generate. I've been working on like a tool, just, a tool that I can give to providers to help them do a step-by-step analysis with like, okay, which eyebrows higher? How much higher? Let's measure it. Let's see like, which cheek is higher. Measure it. What's the normal ratio? What is this patient? To sort of give them a checklist of things to do. But I think if you could put your face on a screen like this and have the AI analytics do the work for the provider, at least initially, to say, okay, this is where the patient's deficient. Like, give me your before picture when you were 20. Give me your current picture when you're 55. Let me see where the subtraction has occurred. Let me see where the volume loss has occurred. Now let me give you some ideas as to what you can do to make this patient look, younger. That's a really helpful tool because that's educational, right? So, rather than AI doing anything, AI is providing you with education, right? Just kind of like I provide them with education, but mine's imperfect. Everyone's imperfect. But like if an AI could at least, if you could just put your face in it, you could develop a tool at Symplast or someplace and said, okay, this is what you need. You need this product here. That would be very, very helpful. It would simplify the treatments. It would give the provider good experience. It would give them the opportunity to provide a better outcome, and it would be a really great educational tool. And I think that would, because that to me is the hardest step. You could teach anybody how to inject anything, anywhere, at any time. That's not, that's easy. You can show techniques, you can tell them what product to use, but if they don't know where to put it and how much to put it and what product to use, that can create a lot of bad outcomes. But do you think that's possible, Shashi, with Symplast someday? Can you see a vision of that assessment tool being useful?
No, you can do it today, Joe. You can actually do it today. As a matter of fact, people are already doing it, and it's not the physicians doing it, patients are doing it. As you know, I do mostly facial rejuvenation, and I've had no less than 3 people in the last month alone who have used their younger versions of photos and
Yes.
their current version of photos, and they have created an output using Gemini, Google Gemini, Nano Banana type of tools or ChatGPT tools, and they've created a version of what they feel they want to look like that they've endorsed on their own. So this morphing business is now out of the hands really of the physicians themselves. It's going to the patients, the consumer, direct to DTC, direct to consumer, and they're bringing it in and say as an inspiration, this is kind of, what do you think this is possible? And the very first thing there to do is, like you said, is to take their younger version in a way, simply, like you discussed, and see does it match or not. And that comparison potentially could be done today because there's great imaging tools available now. So I think these kind of tools will become ubiquitous. I think they'll become very, very available, pretty much at zero cost to everybody. And they could become their own assessors of sorts. And now we have to become the arbiters to say, is this a realistic thing or not, whether it can be delivered or not, and then create legal forms to say that, this is only a rendition. We'll have to see how it works in real life. But I do think the idea of going back to their own past and using that as a gauge to see, because like this is the way I explain it. Like if this is ideal, at whatever age you feel it was ideal, and you start dwindling, the goal is to just bring you back there or
Yes.
close to there, not to go here.
Yes.
And that
Yes.
assessment can be provided by these type of tools, which I think will be very helpful. So without deviating too much into something more AI based, but to tie it back to compliance, I think these type of conversations should also be part of an assessment, perhaps, that could be part of staying compliant as well, that are more realistic. So technology can play a role to say that this is not realistic, this is more realistic. And I think that can be created by training and getting good data.
You can't even imagine. Every single class I teach, I do the assessment, and people just literally, honestly can't see it. And then once you teach them to see it, they can't unsee it. It is the most striking, rewarding thing I have ever done, and it's like so hard during the class to do it. By the end of an hour, most of them finally see it and just like, oh my god, how did I not see that? I mean, it's shocking to me, but it's always the same. Like you'll have a model sitting in front of you, 3 people on this side, people on this side. You say, okay, which eyebrow's higher? Half will say the right, half will say the left. They're looking at the same person under the same lighting from the same angle, same distance. Half see it, half don't. All the time, predictably. And a tool like this would be really helpful. But I also like the idea of like, okay, here's my picture. Here's 1,000 results that I've seen before, that the AI has seen before. How does this result compare? Good, below average, above average, excellent, terrible, compared to what I know as an AI, tool. That's really helpful for patients as well. But even to me, more important is the provider. Like the provider needs a little bit of self-reflection. Like, are my results good or not so good compared to my peers, or compared to like 1,000 cases by people like me, who do it. And if I'm not at least average, I need to figure out why and figure out how to get better. But also, like as a provider, I want to know as an injector, like where should I be injecting this patient? Where should I not be injecting? Because my wife brought up something very important. I kind of learned this from her. She's like, you know, like you need to see what people look like before. I never had big lips, and I've always been attractive. Why would you want me to have big lips? That's not who I was. I never had, big cheekbones. So why would you try to make me have big cheekbones? Because that's not who I am. People just want to look like a younger version of themselves, as you point out, not someone else, not there, right? They want to be there, as you point out. So that's really important. Like, let's get the pictures of everyone when they were. I say, bring in a picture of yourself when you look your best at whatever age that was. I don't care what age it was. When you look at that picture, go, my God, I love the way I look in that photograph. Then take a picture of you now, and let's see where the subtraction has occurred. And the AI is potentially going to be better at that than the average injector who's never really developed those skills because we've been taught, oh, this is how we do a cheek. This is how we do a lip. This is how we do this. This is how we do that. Well, no, it isn't how, because that person may never have had a big cheek. Why are we treating the cheek? We're making them look like someone that we want them to look like, not what they want to look like. So I think there's a lot of potential value there. And it's obviously all about what we feed AI. But I think if you latch onto this, the sky's the limit for you. This is
Yeah.
really, really powerful.
Listen, I love that. I think that brings it full circle to the whole concept of keeping the human part within technology, because as humans, we're imperfect, and technology, and if you don't train it right, it's going to go for that perfect version, which is not realistic. And I think that's just such a beautiful point to make. So, Dr. Russo, it would be remiss of me to not mention, we know that there was a big law change on compliance in the state of Massachusetts. And I know that's something that you've dealt with the nurse networks that you provide for. So what are some things that we should leave people with as thoughts of, like, keep this top of mind as we go into what the future of compliance is going to evolve into?
I'm not sure whether it's fortunate or unfortunate, but the compliance is going to get more rigorous.
Yes.
More bad injectors are being released into the world, more adverse events are occurring, more boards are receiving complaints about them, and they're trying to legislate their way out of this by clamping down, and compliance is getting stricter. They're getting tighter everywhere. So it really is going to be a more dangerous world as a provider to live in. But if you're a good provider, if you're well trained and you're living by the letter of the law and you're getting orders and you're doing all the right things, you have nothing to worry about. I mean, you can still have a bad outcome, but as long as you've done everything the right way, that's okay. Maloccurrence is different than malpractice, right? We could all have a bad outcome even though we've done everything right. So the word is that compliance is only going to get more restrictive. You really should pay attention to it. You really need to get a system where you have the highest chance of being really compliant. And it's not going to get any easier. It's going to get harder. And we as physicians, I think, are in a very l- um, I guess, favorable position in that people generally trust us. We're the best trained. We have oversight. We're generally the best educated as well. So it's a lot of responsibility that falls upon us. I urge my fellow physicians to really, step out, become leaders in the industry, really get into it. Lead with compliance because that's really gives you a lot of credibility, and that will lead you along the way.
Yeah. Dr. Kusuma?
I think I'm going to end it there because I think he summarized it very, very well. My goal is going to be to try to push Symplast towards becoming an aid and a tool and an enabler to become better doctors, better service, service care providers, better technology to, be a better human all around, be a better patient, a better physician. I think that's where I'm going to focus. And hopefully the next 2, 3, 4 years for Symplast is going to be heavily AI driven to make it where we give people back a lot of peace of mind, freedom, time, and all that backup, which compliance is going to be automated in a way that's going to keep them safe.
Yeah. Love that. I cannot wait to do the next one with you guys again. Thank you so, so much. And we will see you on the next podcast.